Today we will be discussing on seizure, and especially in seizure we will be discussing on febrile seizure. So let's move directly to the definition. What is febrile seizure? So any seizure event or abnormal body movement or any seizure event that takes place during the febrile period, that is when the body temperature is raised. And the criteria to be included in febrile seizure is that the baby must be of 6 months to 60 months. So generally the babies of 6 months to 60 months, they present with febrile seizure when they have seizure during the febrile period. However, we need to exclude certain things, and that is CNS involvement or infection. Suppose a baby is having meningitis, then we can't label it as febrile seizure. We have to label it as seizure following to meningitis. So CNS infection we have to exclude. We have to exclude previous neurodevelopmental malformations or delays, neurodevelopmental abnormalities. We have to exclude it. And the another criteria to be excluded is that there should be no history of febrile seizures. And certain authors also include electronemia or electrolyte disbalance. So these are the criteria to be called as febrile seizure. So the baby of 6 months to 60 months will have seizure episode during what time? During the febrile period. The point to be noted is that suppose baby may have a seizure, suppose at 6 a.m. However, the temperature might have been noted at 7 a.m. So this can also be true. It also true in case of febrile seizures. The another condition, there can be fever at 7 a.m. and the febrile may arise at 10 a.m. So both conditions are applicable. However, the thing to be noted in this line is that suppose generally the febrile episodes, they occur at the time of rise of temperature or during the fall of temperature. Generally it occurs at the time of rise of temperature. During the peak stage it won't occur or it won't manifest generally as the episode. So during the time of rise of fever it will manifest. So at 6 a.m. there will be gradual rise of fever and then it will manifest as seizures. And when you note it at 7 a.m. it might have been reached to the peak point. So you will note the fever raised up after the episode of seizure. So we must be cautious that generally the seizures take place during the rise or during the fall of temperature. And we need to exclude CNS infections or neurodevelopmental abnormalities, fevrious, and a febrile seizures history. So these are the criteria to be fulfilled in febrile seizures. Now we will discuss about the types of febrile seizures. Broadly speaking, febrile seizures can be divided into two types. They are simple and complex. So what is simple? What is simple febrile seizure and what is complex febrile seizure? So if you look at the time frame, the simple febrile seizures will last less than 15 minutes. However, in case of complex, it will last more than 15 minutes. In case of simple, it is generalized type of seizure involving whole body. However, in case of complex, it is focal or partial involving only one part of the body. And in case of simple, we have discussed it is less than 15 minutes, it is generalized, and there will be only one episode in 24-hour time frame. However, in case of complex, there will be more than one episode in 24-hour time frame. And all the criteria to be kept in complex febrile seizure is that like previous history of neurodevelopmental delay, so there might be neurodevelopmental delay. And one thing to be kept in mind is that sometimes the seizure may fall in this category. However, the number of episodes may be more than one in 24-hour time interval. In that case, we label it as SFS plus. And some authors, they characterize it as complex also. But generally speaking, those type of seizures, they manifest or they progress as a simple febrile seizure only. So we can label it as just FSS plus, and we can move towards the prognosis looking at the features of simple febrile seizure. So this thing to be kept in mind. And as we have already spoken, the most common age group is 6 to 60 months. So one exception or atypical feature is that suppose the baby is of 7 years and he is having febrile seizure during the febrile episode, and he also had some past history in 4 years of age, then we label it as FS plus. So these two things are additional point. However, broadly speaking, we label as simple and complex. And there is another classification, that is febrile status epilepticus. We all know if the episode takes place more than 30 minutes, then it is called as status epilepticus. So the febrile seizure during the time of febrile period, if it occurs more than 30, then it will be labeled as febrile status epilepticus. After talking the different types of febrile seizures, we will be talking about the etiologies of febrile seizures. The first and foremost being genetic factors. So if you find the history, family history, you ask for family history, and then you find there is history of febrile seizure, then the baby has tendency to have febrile seizure. So the tendency increases, or the probability increases, if that febrile seizure is seen in first degree, then second degree. And you must also ask if there is any history of epilepsy in the family too, not just febrile seizure, any other epilepsy characterization if it is there, then you have to take that history also, because in prognosis or in reoccurrence or in late adolescence, those babies who are having febrile seizure, they may manifest as epilepsy. So you have to keep that in mind. So one is genetic factor. 10 febrile gene have been spotted, and the transmission is autosomal dominant or it is polygenic in nature. So this plays a role in causing febrile seizure. The another etiological factor is that if there is history of NICU admission. So rather than etiological factor, I would write as associating factor. So NICU factor, and there is developmental delay, and in these cases, it has been found in research that there is association of febrile seizures. And another factor is that iron deficiency and vitamin D deficiency. So these two, in different research, they have been found that during the investigation time period, the babies, they were having low level of iron and vitamin D. So these things need to be also kept in mind. And another is viral infection. So viral infection, and it can be UTI related febrile seizures, or it can be respiratory infection. So there are many etiological factors. And another is post-immunization, post-vaccination, and the most common being the MMR vaccine. most common being the MMR vaccine. And in that case also, suppose if the vaccination is done in appropriate time period, then it is okay. If the vaccine is missed on that appropriate time period and is done late, then there is higher chance for febrile seizures. So these are the different etiological factors. And HSV6 and HSV7, they are also linked with febrile seizures. So these things we have to keep in mind. Now we'll be talking about investigations and what to do in case of simple and complex febrile seizures. Generally speaking, if it is simple complex fever, if it is simple febrile seizure, then no any investigations as such. So we have to keep in mind, if it is just first episode and it is not a recurrent case and there is no any other risk factors, I will talk those later on. So if it is simple, just single episode and it is simple, then no any kind of investigations need to be done. However, if it is complex febrile seizures and if it is recurrent in nature and you suspect any of the risk factors, so what could be the risk factors? It could be like meningitis. Okay, you are suspecting meningitis on clinical basis like meningeal signs, and if you are suspecting like neurodevelopmental delay or neurodevelopmental anomalies, then you can go for investigations. So let's talk what can be the different types of investigations. So first and foremost being blood work. So in blood work, what we will do? Random blood sugar. Most of the time, the baby will have hypoglycemia, and because of that, they will manifest as seizures. So you need to rule out whether the blood glucose level is normal or not. And different electrolyte levels you can also measure, like in case of hypocalcemia, decreased calcium, and decreased magnesium level also, it can manifest as seizures. So we have to rule out those this electrolyte disbalance. And after working out random blood sugar, then you can go for blood culture, and you may also go for urine culture. And these are basically to confirm the infection, and then we are searching especially for the cause etiology of fever rather than just a seizure, because if you be able to find the source of fever and you treat that cause, then automatically febrile seizure will be abolished. Then another investigation what you can do is like EEG. So generally speaking, EEG is not so useful or helpful in case of simple febrile seizure and complex febrile seizures also. But if you find that there is a family history, so if you find that there is a family history of epilepsy, or there is family history of febrile seizures, and you suspect there can be like developmental abnormalities, or you find that there can be certain focalization of the episodes, and if it is recurrent, then in these cases you can go for EEG. And especially if there is family history of epilepsy, and if it is any kind of syndromic cause, then EEG is very much beneficial. So there are mainly three indications of EEG. One is that you find any kind of syndromic epilepsy, and another is that whether you need to start, rather than start, if you need to like stop the therapy. Suppose you are giving AED, anti-epileptic drug, and for more than 2 years there is no any episode, then you need to monitor EEG in daytime and nighttime, and then if it is normal, then you can stop the anti-epileptic drugs. So these are the different conditions in which you can go for EEG. And another is like MRI Ct Scan. So again, I am repeating, in case of simple febrile seizures, MRI and Ct scan is not generally indicated. However, if there is like any kind of focalization and you find that there is like anatomical abnormalities or variations or hydrocephalus, then you can go in those cases. And if it is called recurrent cases, then you can go for MRI and Ct scan. And another is that lumbar puncture or CSF. And it is especially important only if you are suspecting meningitis. So if you are suspecting meningitis, then go for it. Otherwise, in case of simple, no need to go. And if you are there is like case of 6 to 12 months baby, and there is negative history of HIV vaccination and pneumococcal vaccination, then it can be an indication to go for lumbar puncture or CSF detection. And other investigations, what you can do is that we have already talked about the blood group in blood investigations, and we have talked about EEG, MRI and Ct scan, and lumbar puncture. So broadly, these are the main lab investigations. However, the thing to be again kept in mind is that you must find the source of fever. So for investigation fever, you need to do other associated investigations. Suppose if it is like a respiratory cause, then you may go for like a swab culture of the throat or anything like that. But generally speaking, in case of febrile seizures, if it is simple febrile seizures, then you need to consult the parents. You have to suggest to them that you have to counsel them that it generally occurs during this age group, and it is the manifestation of the raised body temperature, and it will gradually subside on itself. Now we will be talking about risk factor for recurrence. So what are the risk factor for recurrent febrile seizure? One being that baby is less than 18 months old. So baby is less than 18 months old. And another being is that suppose there is like a family history is positive, a family history of febrile seizure, then there will be the chance of recurrence. And the another being is that suppose if the febrile episode occurs at low temperature. So I'll explain it. Suppose if there is fever at 102 degree Fahrenheit, and you have a febrile episode, and another is baby is suppose 105 degree Fahrenheit, then the chance is that this baby will have more chance of recurrence. And another is time interval between fever and seizure. So why is it important? Because suppose it is 6 a.m. and one baby has seizure at 7 a.m. and another baby is there, it is 6 a.m. and he has episode at 10 a.m. Then this baby will have more chance of recurrence than this baby. So these are the different factors relating to recurrency. And another being, suppose in 24 hours, if there is multiple episodes, then we can predict that in another febrile condition that the baby will have febrile seizure. And now we talk about what are the risk factors for recurrence or epilepsy. So recurrent febrile seizure we have talked. Now what are the risk factors for epilepsy or that baby going into epileptic disorder? So the first being if it is complex febrile seizure and it is prolonged in nature, that is more than 15 minutes, and if there is neurodevelopmental dysfunction, previous history, and the other being that time interval between the episode of fever and seizure. So if it is less, then there can be also a chance of epilepsy during the adolescent time period. And another is family history. Suppose if the family history is positive for epilepsy, then that child may later also manifest as epileptic syndrome.